I'm with Raed Sadek from Red Noses International Palestine. Now, Raed, what is Red Noses International Palestine?
Well, it's a charity. It's an organization that is registered, under charity organization law in Palestine since 2002. And it's a branch for Red Noses International, based in Austria, Vienna. We're just a branch for the organization.
Why did you start here in Palestine?
Well, it started with a project. There has been a need. Palestinian children are always in need. They're traumatized. The hospitals, that really requires, a better service, especially the governmental hospitals. So when we started in 2010 as a project, as a pilot project, it appeared that there has been a real need in the Palestinian community with, to support children and give them, uplift their spirits in Palestinian hospitals who has, the minimum of the mental or let's say well-being services for children in the pediatric sections.
And how many institutions do you go into? And how many people do you reach a year?
Well, what we do, we work with 13 hospitals, for pediatrics, with children. So almost all of the governmental hospital in Palestine, we will be expanding more if there are other opportunities, but that covers, most of the, I think all of the Palestinian, most of them. There's one left in Salfit that we will be also targeting next year, but that covers, most of the hospitals. We do an average of 90 visits a year for pediatric sections in Palestinian hospitals.
And what sort of things do you do with the kids?
The main work, we have different programs. The main work for Red Noses clowns is to do a bedside visits. So 2 clowns, they go to inside the hospital, they visit, for 3 hours, 2 to 3 hours, depending how big is the section in the hospital, and they conduct healthcare clowning, what we call bedside visits. So each child in the hospital as a patient gets a specific time, just to help him, overcome the difficult time that he or she is facing during the treatment process. And of course, some of them are for short periods, a week, 2 days, they enjoy the healthcare clowning. But some of them, especially in cancer hospitals for children, it takes, their residence. So clowns are becoming part of their weekly life, let me say. They see them twice a week. They know them. They know their personalities. They know who they are. They play with them. It depends, on the section, the pediatric section that the clowns are visiting.
How do the children respond?
To tell you the truth, when I moved to Red Noses a year ago, almost a year, so it was also a new thing for me to see what do we really do and how much do we impact the children communities, in the hospitals, in a marginalized area. And it was roaring. It was really great. I couldn't imagine how children are attached to such characters, touchable, really human beings that work with them in such difficult time. They're so much accepted, not only by the children, but, by the parents who really needs a break during these visits, by the medical staff who also needs a break and learn some of the skills that we provide. So we impact the whole environment in the hospital, and the reaction from children is extremely, astonishing, when you see that, that they've been waiting for the visit, all around the week, and those who have seen it is seeing it for the first time. Of course, that is the astonishing part. You can see the laughter, the move from sadness to a smile to a deep laughter. And that nothing can really make you happier to see that. And I've seen that from the first few visits, and I knew how important, healthcare clowning in Palestine and worldwide is, and what essential role it is playing.
Does it impact you as much as it impacts the kids?
Absolutely. Imagine, when you work in a place that is full of joy and laughter, and that is the basic work of it, It's definitely a serious job, because we'll talk about it, but, it is a very serious job, because making people, laugh and uplift their spirits and helping their mental health is a very serious job, because you're doing it in a way that is different from the classical, treatment ways. But it is based on joy and laughter. But in order to do so, it is a long process of seriousness and serious work and hard work for the clowns, for the management team. But in the end, you end up also happy because that is the spirit of our organization is just to make sure that not only the clowns, but us as a team is also happy. Because if you're happy, you can spread happiness. If you're not, then it's going to be difficult for you to serve your communities. So we also focus on our own well-being in order to help the well-being of children in the hospitals.
Does this help the staff as well, the doctors and the nurses?
Yes, of course. For them, in addition that it's a break, and they're enjoying the visit, but from our deep belief that healthcare clowning should be inseparable part of the treatment or, from the health arena. What we do is we take that to a step up where we train the medical staff in the hospitals how to use the skills that clowns are using. They're not going to be clowns because, healthcare clowns go into a long process of training and a curricula that has to go through and accumulation of experiences to become a healthcare clowns. But what we do is we also train medical staff, doctors and nurses that, there are some skills that you can use in order to make children happier. And also, if they're happier, then your job will get easier. Their acceptance to the treatment will become much more easier. They will accept you because our clowns, they are dressed as doctors. They're clown doctors. They are dressed in the white coat, they some funky clothes here and there, but they look like funny doctors. And we really ask the medical staff and we train them how to be able to use minimum skills just to make sure that the child accept the treatment by them, accept, the needles, accept, the checking, some little skills can make a big difference for their work, and it really proved so.
Are you all over Palestine? Are you also in Gaza?
Unfortunately, not in Gaza, but yes, in all West Bank. We work in all cities and hospitals in West Bank. In Gaza, and there are, we are really so much open, but as you know, the security political conditions are really an obstacle. We are locally registered here as a branch office, so we're not, getting special permits to go to Gaza is difficult. Bringing people from Gaza is difficult. We really hope that some of the international partners can really provide such support on this. But the other thing is that in order to guarantee the sustainability of healthcare clowning in Gaza and to go into the process, it's a long process. So it's not just 2 days training here or, our artistic director goes and train people and that's it. No, it's a long process that requires ongoing contact with the selected clowns to be able to go inside the hospital. We really do want to go to Gaza and we believe that there is a big gap that needs to be bridged, in Gaza, but technically, and logistically we cannot, unfortunately. And we know by all means we have wonderful artists in Gaza that can really take this message and take it, to different beautiful levels because there are some talented, artists in Gaza that we can really benefit from. But unfortunately, under these circumstances, we can't.
How many professional clowns do you have?
We have 28 professional clowns currently that are having, weekly visits to the hospitals.
And what sort of other programs do you do as well? Do you visit other places as well?
Yes, in all the Palestinian hospitals, mostly, one is still needed to be added. But let me talk a bit about the programs. As I said earlier, the main work is bedside visit in the hospitals, and that's where we go. All West Bank and East Jerusalem hospitals, we visit them, on 2 visits a week. But we also approach children outside the hospitals, and that's what we call outreach visits. And so we either select the communities or some of our international partners who work with children in marginalized areas, and they know that there is a need there. So we cooperate with them and we send our clowns in what we call the outreach program. And that another 2 clowns go to a specific area, spend the day with the children, work with them, uplift their spirits. And as you know, the occupation has been doing the most difficult or most the biggest violations in Area C, where displacement is taking place, settlements, is taking place, demolishing of houses and schools. So children are also in need of a quality smile. They need of joy. And they don't understand politics, but at least, you might also approach them in different ways in psychosocial support. But at the same time, we believe that our way is very innovative and it is very accepted and it is very well tailored to traumatize children in a new concept and a new approach that is closer to them, more understandable, for the children. So we partner with other organizations and we provide the services, based on the need. And we also, part of our funding is also tailored to support children in marginalized areas. In addition to that, we have a program called Circus Smile. And that's where it is very similar to the outreach, but it's not a one-day visit, it's a 4 days visit, where we live within the community. We stay with them, we train children to perform circus smile, a circus performance in front of their communities, their parents, their school teachers, so that they are able to overcome stage fear, to have more self-confidence and self-esteem, that they can do things that they are not used to. In addition to that, we do the HIH, which I told you about, the training of medical staff, which we call Human in Healthcare, HIH. And that targets, educational facilities, universities, medical train in educational institutions and health facilities. We train in schools, in the universities, we train medical students, we train nurses who are, going to go into the hospital soon in their last year. So we train them on human in healthcare so that they know what to do, and it helps them to also to be accepted in the hospital environment easy, and then by the children if they're working in the pediatric sections. So that's another program. We also have what we call Emergency Smile program, and that is a very, let's say, different program. It's not in country, where we send our clowns to areas, in crisis and war zones. And believe it or not, our Palestinian clowns has been trained for many years to do so. We have a success, stories about Palestinian clowns going to Zatari in Jordan, Zatari camp. They're going to Poland, with Ukrainian refugees. They're going to Greece with, Syrian refugees. It is kind of a refugee to refugee support. In a way, this is how I see it, because we understand, how difficult the refugees' lives is as Palestinians, and so our clowns are really successful in that field and really competing a lot with other international clowns when they go and visit refugees in areas of crisis. So this is another program. What we do also among the other programs is that children are not the only audience that really requires a good smile in difficult time, but also elderly people. So we visit 7 elderly care centers in West Bank, where the clowns, go to the elderly centers, work with the people there, uplift their spirits. Same, whether you are in a hospital or in an elderly center, the feeling of negligence, the feeling of being abandoned, the feeling of that something will happen to you, they're the same. So we also target these elderly homes in a way to uplift their spirits. And of course, the approach is different. You cannot sing, children's songs, for elderly people in the elderly centers, but you give them, songs and jokes from their time. And so our part, half of our clowns actually are trained to give elderly centers, visits and work with them, to uplift their spirits.
Wow. Is laughter good for you?
Absolutely. It's research evidence based. Laughter does really support your spirits. There are so many researches that talks about importance of laughter and joy in your daily life, and I cannot tell you, you can go and see. We also base our work on research. In Palestine, we have done a research, that will be launched soon. I can share it with you, where we believe that we have conducted the research to see the impact of healthcare clowning on children in the hospitals, and whether joy and laughter really have an impact on children in pediatric sections, in hospitals and in marginalized areas. And Well, the first results, clearly shows how important joy and laughter, to the treatment process. But for us, yes, absolutely. Joy and laughter is part of our work. We make sure that, to keep in that frame, to continue our work. We believe that we also need joy and laughter, not us, but also other organizations. We advise them that joy and laughter is part of a successful job, of a successful workplace. And this is what we do also. We do humor workshops, and we provide for some organizations, a workshop for the staff, for their staff, where we can work with the staff to appreciate and acknowledge and see the joy and laughter around them and grasp it and make sure that they benefit from it, because it is important on their daily life. If they don't laugh and they don't have a joy in a workplace, come on, that will be just a boring place, to work in. So we also try to help other organizations to see the importance of humor and joy in their work.
Do you have any stories of people that you've worked with?
Oh, there are many. I'll tell you a story. We started to do Clown Cast. It's a podcast, but a clown is telling the story. The clowns are not just service providers for us, they're storytellers. So we started to see how important their stories are to our audience. And when we started to launch these inspiring stories, the children who are on social media, they started to get in touch with the clowns, Yes, Dr. Batta, Doctor, because they all have different names, I've seen you, and that is the kind of success that you see when children are outside the hospitals and they still believe, or they still take the fun time that they spend in the hospital outside the hospital with them and connect to their clowns who are their, heroic figures, who stood next to them. She started to hear the clown cast and she identified her clown. And she started, sending, for our communication officer, can you connect me? I'm out of the hospital. I really want to see Dr. Batta, where is she? So we started to connect them away from the hospital, just making sure that they get, their figures, also closer to them. Some of these, especially that girl, she is a cancer survivor. She still needs that support. She goes, not regularly to the hospital, she goes for regular checks, but the clown is there for her, when she needs it, when she needs her. So, yeah, that is one of the loveliest stories, that when it is not just a hospital-based thing, they can also approach them when they need them outside the hospital.
Wow. How are you funded? Are you a charity organization?
Yes, we count so much on donors funding. Here, especially in Palestine, we are currently funded by, until end of June, we will be we have been funded actually for the last 12 years. Austrian Development Agency has been a great support for our work. They supported the establishment of Red Noses from the early beginnings, and they stayed with us for 12 years. We're not sure how, if this is going to go for more, but we understand that donors, their strategies change and they might, see other opportunities, other needs that they need to cover. We totally understand. We're also funded by Drossos, which is a Swiss organization. And we are, of course, mainly funded by our home office, Red Noses International in Vienna, which is the core funding of our work.
What's your hope for the future?
My biggest ambition as a managing director for Red Noses is to be able to implant, the culture of health crowning as an inseparable part of health sector. It is important for people to see the importance of it. And to tell you the truth, not in the last year only, the years before, I came to a more understanding environment of how important the clowns are needed in the hospitals and in marginalized areas. There will always be people who say, I'll tell you another story that was really a success story. We were in Hebron last week. We wanted to see a visit, and I wanted to meet the management of the hospital just to do a follow-up about our work, what is needed, how can we further support, the hospital. And at that time, there was a visit for the clowns. So we have watched some of it, and suddenly when the clowns went inside a room, a lady who went out burst into anger. Oof! Why are they coming? this is, this is really, we're already so sad, why, she had that red face on her, I said, oh my God, that's really, I didn't speak to her, she left, of course, she allowed the clowns in the room, she left the room, she kept her children inside. They all continued, we wrapped up, and we went out the hospital, and there, I found that same lady, on the hospital with my colleague, she was laughing and laughing. I told her, you have already been, I didn't expect that. I haven't seen the clowns. And I didn't think that it was useful to my child. When I saw him laughing, my life has changed. She burst into tears, she told me, I haven't seen him. I've been here for a week. I'm already suffering, from my sadness, his sadness. But when I saw him burst into laughs, it has totally changed. I am amazed with what clowns can do. I did not expect that this impact this will help my child. And I'm sorry if I really was sad, I was sad because my child is sick, but I didn't know how important it is. So what was your question about, I want this to be sustainable. What I'm trying to do is to make Red Noses as a healthcare clowning organization lives in Palestine. We've been there for 13 years. I really want this to continue forever because our children are really in need. Whether they're in hospital, they're outside the hospital, we have a real need, to uplift their spirits. In we work in 11 countries. They do outreach, they do also bedside visits in the hospitals. But when I look at the marginalized areas in Palestine, and how much they suffer, I believe that we are in need more than any other place to uplift the spirits of the children in Palestine. So Red Noses stays, service stays. We have more children who understand, themselves, who can really enjoy and see laughter and joy and humor as part of their lives. Because if we continue our lives living and hearing sad news every day, which is part of our lives, we cannot deny that, but children doesn't have to pay the price for that. Children are children. They shouldn't be suffering. They need to understand that their age is an age of joy and laughter, not an age of sorrows and agonies and sadness. And that really impacts the children when they grow up. Because if you grow up seeing your childhood as a sad childhood, that is not a good thing. Child is a child, needs to enjoy and laugh and play. And I really want Red Noses to stay until we are able to fully provide and expand to fully provide our services to all Palestinian children in Palestine. That is my biggest ambition.
What's your website, Facebook page for people who'd like to know more?
Yeah, our website is www.rednoses.ps. Our Facebook is called Red Noses Palestine. Same for Instagram as well.
Okay, Raed, thank you very much.
You're welcome, Habibi. Thank you. I really enjoyed it, and I wish you best of luck.